Today we are going to review a few of the important exercises that should be performed at home in order to maximize the results of your total joint replacement. Each should be performed daily for 20 repetitions. Break up the repetitions into sets as needed. It is normal for your operative leg to feel heavy and weak compared to your non-operative leg. Swelling in the surgical area is also normal in this stage of your recovery, so elevation and icing of the extremity is recommended afterwards. Stop performing the exercises if you feel a significant increase in pain, shortness of breath, or dizziness, and contact your doctor. Long arc quadricep strengthening. While sitting upright in a chair with your feet flat on the floor, straighten your leg while keeping your toes pointed towards the ceiling. When your leg is fully straight, pause for a brief moment and then return to the floor slowly. Repeat on both legs. Straight leg raises. While laying in bed, raise your entire surgical leg 6 to 12 inches while keeping your knees straight and toes pointed towards the ceiling. Return to the starting position slowly and repeat on both legs. Standing hip flexion. While standing with your walker, raise your surgical leg towards the crossbar of the walker like you are marching in place. Make sure the other leg remains straight and your torso remains upright. Use your arms as needed for support and balance, and repeat on the opposite leg. Seated heel slides. This is for total knee replacements only. While sitting upright in a chair with your feet on the floor, cross your legs at the ankles with the surgical leg on the bottom. Attempt to slide your heel as far under the chair as possible, assisting with the opposite leg as needed, and while keeping your hips and buttocks on the chair. Standing hip abduction. While standing with your walker, raise your surgical leg out to the side, keeping your toes pointing forward. Make sure the other leg remains straight and your torso remains upright. Use your arms for support and balance as needed. Repeat on the opposite leg. Posterior hip precautions. After having a total hip replacement, there are 3 movements that should be avoided in order to ensure the safety and effective healing of your joint replacement. Number 1, no hip flexion past 90 degrees. With your new hip replacement, bending forward and creating an angle smaller than 90 degrees at the hip should be avoided. This includes attempting to put on shoes without an appropriate assistive device, leaning too far forward to stand from a chair or surface, and attempting to pick items up off the floor. Number 2, no internal rotation. When walking, your toes should be pointed forward, not facing towards your other foot. Also, when turning or pivoting, turn in the direction of the non-operative leg. Number 3, no adduction past neutral. When getting out of bed, it would be best if you got out of bed on the side of your operative leg. For example, for a left hip replacement, you should get out of bed on the left side of the bed. If this method is not safe or feasible, then segmentally transition to the edge of the bed in 6-inch increments as to not cross midline. Also, when sitting in a chair, do not cross your legs or your ankles. The car transfer. When entering or exiting a car, setup is key. The seat of the vehicle should be reclined and moved back in order to provide maximum available legroom. Use a plastic bag to minimize friction when sitting and sliding on the seat. To enter the car, ambulate as close to the vehicle as possible. Back up towards the car until you feel the car against the back of both of your legs. Without holding onto the door and using the seat, door frame, or dashboard, sit on the seat after kicking your operative leg out in front of you. Once seated, move back into the seat towards the center console. As you rotate your hips and your shoulders into the car, bring in your left leg, followed by bringing in the right leg. Once you are safely and comfortably inside the vehicle, the seat can be adjusted for comfort. Perform this technique in reverse to exit the vehicle. Remember not to hold on to or reach for the door at any time as the door moves and creates an unsafe environment. Bed mobility with posterior hip precautions. It is best to exit the bed on the same side as your hip replacement as to not break your hip precautions. After removing the pillow between your legs, along with all blankets and sheets, move your hips towards the edge of the bed before moving your legs. Bring your operative leg off the edge of the bed. Using your upper body and arms, sit upright in bed and continue to move your operative leg more and more off the side of the bed, following with your non-operative leg. Use your arms and upper body to assist moving your buttocks and hips towards the edge and continue this process until both feet are flat on the floor.